And we are now back live to France to discover one of the main partners of the 24-hour holographic surgery, the Evolutis company, which has gathered around experts to discuss the issues of mixed reality. Hello, everyone. Hello, Jean-Michel Péguet.
Hello.
You are president of Evolutis. There is here too Professor Philippe Ernigout, elected president of the SICOT, the International Society for Orthopedic and Trauma Surgery. We have to Louis Dagneux. Hello, Louis, are you there?
Good morning, everyone.
Good morning. You are the president of le Collège des jeunes orthopédistes. Adrien Kérac est avec nous également. Adrien Kérac, you are a mixed reality specialist for Europe for Microsoft, and Professor Thomas Gregory. So Jean-Michel Péguet, we're going to start with you. Can you please present Evolutis to us in a few words?
Yes, thank you. Good morning, everywhere. Good morning, good evening, good afternoon. It's a worldwide event. Thank you very much for this opportunity. Yes, when we decided to go back to explain the situation, when we decided 3 years ago to put a foot on this on this moon, it was a real challenge for our company and a very big opportunity. Thanks Thomas Gregory vision, within 4 months we made this first premiere reality, and it was in December 2017. We made the first proof of concept, and it was a success to demonstrate that the use of Halolens in an operating theater could be of huge interest for the surgeons. Then we decided to be part of this potential new revolution, I would say revolution. Evolutis, to present the company, Evolutis has an experience of more than 20 years in developing, manufacturing, and selling orthopedic articular implants for hand, shoulder, hip, and knee. We are strategically oriented in the development of digital solutions for training, assisting, and guiding the orthopedic surgeons when implanting a new joint device. And Halolens is the perfect tool to implement our strategy. It is highly technical, it is connected, lightweight for everyday use, and for an easy delivery everywhere, and it is economically affordable.
Jean-Michel, there's something that you don't say to us, that you were the first one to design a revolutioning prosthesis. Thomas, can you explain to us what Jean-Michel did a long time ago, but it's still a very important...
It's a long time.
Yes, it was a first life where he was an engineer, and I think that the revolution of the orthopedic surgery after the Second World War was due to the meeting between surgeons and engineers, and very clever engineers. And Jean-Michel was a very clever engineer that designed, with a very famous French surgeon called Paul Gramont, the concept of the reverse shoulder arthroplasty. I think Philippe Ernigout, Louis Dagneux will agree that this is perhaps one of the most important evolution of the shoulder surgery to date.
So now, Jean-Michel Péguet, you have to do with mixed reality. Can you tell us what does it change in your profession?
In fact, the Halolens technology for Evolutis is the milestone of a strategy in 3 steps. The current step, surgical training before surgery or intraoperatively, and sharing experience between doctors and between our technical experts and user surgeons, and exhibiting holographic data, improving the surgeon's knowledge of the surgical site, such as displaying 3D reconstruction of the patient's anatomy. This is the head-up application. This is our first step, the current step where we are. And the second step is templating and live intra-operative adjustment of the implant size, offset, thickness of liners on the X-ray of the patient, providing the surgeon more accuracy and more security when selecting the final implants, and guidance of the surgeon's actions through digital merging of the 2D reconstruction with the real anatomy of the patient and Hololens guide instruments. This is the step 2. We are not at this step, but it is what we are focusing on. The third step is a continuous collection of surgical data, feeding an artificial intelligence database, a big database, and developments and adjusted algorithm that will maybe enable the future generation of Hololens to assist the surgeons in decision making and secure even more their practice.
Okay, thank you, Jean-Michel. Professor Philippe Ernigoux, you are elected president of the SICOT, International Society for Shoulder and Elbow Surgery.
No, for orthopedic surgery.
Orthopedic, yeah, okay. What do you think of these 2 days entirely devoted to the future of digital technology, of mixed reality?
I will say that it's a new step in the education and research for surgeons.
Yeah.
Our society is present in 100 countries, so it's a global society. And I believe that such a new tool is able to provide new education and a new way of research for all surgeons in the world, because they can speak all over the world, and they can ask to another colleague some advice and provide, and at limit, they can do operation together. This is the first point. The second point is probably for education.
Yeah.
This way allows to give some information to new surgeons at the beginning of their practice, and they can win some time by such a tool for their education. And also this allows, of course, some experimented surgeons to give new advice for young surgeons and to help in this practice. So I believe that it's a real tool for surgeons, but it's also probably a new way for patients, because you can have a patient in one country and advice in another country. And it's a global way of health. And it's a new tool. And the future is probably what we will decide and what the patient also will get from this new tool.
As you're talking about young orthopedists, I think it's time to talk with Louis Dagneux. Louis Dagneux is president of the Society of Young Orthopedists, Collège des Jeunes Orthopédistes en France. What are, please, Louis Dagneux, welcome. What are the technological booms that are snaking up your block work today?
So, first of all, I wanted to thank you, Professor Thomas Gregory, for this kind invitation as president of the Young Orthopedic Trainees in France. We are already augmented orthopedic surgeons. Fact is, following industrial and numerical revolution is mandatory in the orthopedic field, and this is what we have done for decades. In regards to the importance of the numerical environment we get in the OR, young surgeons need to be better prepared. I mean, for the huge amount of numerical data that we have during the surgical procedure. In my view, a learning module dedicated to new technologies is mandatory for the residency program. And our role is to give to young surgeons finally the keys, the skills to be able to criticize his own technique, of course, or to criticize the new technologies that we want to use.
As we're talking about education, Thomas Grégory, can you tell us a little about that? What's going on right now around the world, talking about education on those new technology, and in particular here in France, where you are learning all those new technologies?
I think I will answer in two ways.
Yes.
First way, we have to learn how to use this technology.
Mm-hmm.
Any new device needs a learning program before the surgeon use it in the theater, and that's the goal of our training program created within the La Maison des Sciences Numériques in the University Sorbonne Paris Nord. It's a training program where surgeons from all over the world can join to be perfectly confident in the technology and the use of the technology before testing it and using it for the first time in their theater and in their own practice. Second thing is the way we use it, because I think we are the first surgical department in the world to use the system as a routine practice. And the first benefit is really a benefit from education. So we've got globally a group of Teams accounts. So, any registrar, any surgeon has his Teams account, and we are connected all day long to this Teams account, and we can contact the surgeon, one of the surgeons of the team, performing a surgery, and all the team can see exactly what this surgeon sees. We can record the surgery itself, and this interactivity allows each of the registrars to assist to the surgery, because so far only one registrar was the assistant and learned from a very interesting surgery. So here in the team, all the registrars can learn from the surgery, and we can also record the surgery and analyze the surgery the day after during our meeting staff to improve it steps days after days.
Jean-Michel Péguet, when we prepared this interview, you tell me a real great sentence. You said that with HoloLens 2, we are in the eyes of the surgeons. And for the formation, for education, it's an incredible place, isn't it?
Yes, it's a very good way to teach to someone else how to use the implants, or to explain the situation in the operating room. It is a real merging in the operating room from our desk without leaving our house. And I would say, in addition, is that it can save a lot of carbon for the planet. It's incredible. We used to travel a lot to get flights and to help surgeons to start using our implants. And then now we can do it directly from our chair.
Yeah, you told me that in 2019 you made a full cycle of the world to work with surgeons all over the world.
Yes, it is, or it was our work, to travel a lot, to visit surgeons, to visit them with French surgeons, to explain them how to use our implants, or to invite them in France to see surgeries. And now with HoloLens, we can do this many times without using any plane.
And
it's
tell me,
a great evolution.
You told me too that this HoloLens is a revolution, and that surgeons should dare to wear it. What do you mean by that?
Sorry, should?
You told me that surgeons should dare to wear it, not be afraid to try it.
We will see. We don't know. What I can say is that Evolutis is a good player between the manufacturer, Microsoft, and the surgeon user. to help the surgeon to use this new device in the operating theaters, to use the tools to display the holographic image of the patient. And we have opened a window in our website to help the surgeons to make this path.
Thomas, what would you say to young surgeons? And I will ask then the question to your colleague to try those HoloLens to make the step toward this new technology.
I'm not sure I will have to say anything. I think because there is a mutual adherence, especially of the youngest generation, towards digital technology, a new device to test it. And I think Philippe Ernigou said something very important. It is really the benefit each of the player will see in using the system that will tell us in the future if it's the good system, and I strongly believe it is, or just a step towards an even better system.
Louis Daniel, what do you think about that?
Now it's a time for big data, embarked sensor, robotic arm surgery, and patient-specific procedures. So we are in. And the way to use patient data from Health Data Hub, for instance, will be crucial to learn from mistakes and for continuous improvement. In regards to innovation, we must keep in mind that the only aim that we target as orthopedic surgeon is the functional improvement and the service rendered to our patients. And as such, I do think that validated result publishing and putting new technologies in question must be part of the process.
Adrien Queyrac, strategic sales, mixed reality at Microsoft. How do you see the development of HoloLens? Can you tell us some concrete examples, if it's possible?
Yeah, we'll try without to say anything regarding the confidentiality of our roadmap, of course. But since the last couple of years, we discovered that our ecosystem for healthcare. We started maybe with 2-3 partners, and today we are maybe around 20-25 partners in healthcare industry designing solutions for healthcare company thanks to mixed reality. And our main mission is really to help people and organizations to achieve more thanks to mixed reality. And we want really to help a partner like Evolutis to change their business model by adding artificial intelligence, by adding a new type of sensor, and combine all this information in front of the eye of the surgeon. And for us, it's really important to consider that mixed reality, it's something new. We know that. We consider that as a third wave of computing after the PC, after the smartphone. And right now, the mixed reality can combine a lot of IoT, artificial intelligence information. And we strongly believe that for the future, the collaboration will be more and more present, not only with video, but maybe something between holoportation, how you could share a real space with a digital environment and combine both. And even if Thomas today is present with us physically, we can imagine that tomorrow Thomas can travel thanks to the mixed reality via his own holograms inside the different block to collaborate with his colleagues.
Thomas, what do you think about that?
Yeah, I think it's a great idea. I think, I don't know if I have to say a word of conclusion.
Yeah,
or not.
Absolutely.
I think that after the Second World War, there was a golden age for the surgery due to a special partnership between industry and surgery. And it was especially strong in orthopedic surgery due to the relationship between the surgeon and the bioengineer. And Jean-Michel is a perfect example. And now we are at a close of a new golden age for surgery, and it's due to the new partnership between surgery and industry, but industry of the information and communications. And HoloLens, it's one perfect example of what this revolution of information and communication can change radically our practice and learning. And finally, as Louis Dagneau says, the outcome for our patients.
Thank you very much.
Thank you.